More often than not, we women actually tend to prioritize the health of our loved ones over us. And it's not completely wrong, but it's actually very important as well to take care of ourselves while we are juggling our professional lives, our personal lives, running the engine, work, taking care of our homes, taking care of our loved ones. Because after all, we can't pour from an empty cup. And with this, I'll quickly introduce Circle Health. We are your health partner, of course. We are an accountable health cover that actually keeps you healthy. That means we take end-to-end responsibility for all the aspects of your health we focus on reducing illnesses while managing your day-to-day needs. So we work with network of doctors, and all of our doctors and experts are rewarded based on the health outcomes that we achieve with you. And of course, the man of the hour. So we have Dr. KV Arun Sharma present with us today. He has a rich experience of 45 years and above. He's an army retired doctor. He has done an MBBS and MD in obstetrics and gynecology. He has worked with military hospitals across India, ECFMG, Medicity Institute of Medical Sciences. Along with that, he loves traveling, he loves photography, and he loves videography. I mean, like, that's very impressive coming from a doctor. And his vision as a doctor is to understand the root cause of health issues rather than just diagnose and treat the symptoms of their patients. Dr. KV Arun Sharma, over to you.
Actually, unfortunately, in any society, more so earlier and not that much now, we are not giving as much care we should give to the women. Because after all, one thing we should understand is a woman is the foundation for the next generations. She is the first teacher in the family. So all these things have to be kept in mind, and we have to look after the women in the best way possible. Now, by looking after the women the best way possible, ideally, when should we start looking after a woman? The women should be looked after. We should start looking after the woman from the time she is in her mother's womb. Please don't think that I am exaggerating it, because most of the foundations for good health are laid during those 10 months of sojourn in the mother's womb. So, in summary, we have to look after every pregnant lady, thinking that she's carrying a female baby, so that our future women would be very, very healthy. Now, actually, and then after the birth, we all know nowadays, especially the girl babies, they are subjected to a lot of harassment. And in this particular instance, parents have a lot to do to ensure that the girl is able to protect herself from bad events. In fact, I'm very glad that unlike in our days, nowadays in the schools, as my grandchildren tell, they are being taught in the elementary level itself what is good touch, what is bad touch. And this has to be explained to the girl child especially, also to the male baby. After all, male babies are also not exempt from violent behavior by some unscrupulous people. So they have to be told what is the good touch, what is the bad touch. And for the mothers, my advice is, as far as the male violence is concerned, you can be absolutely certain that the other individual is not going to be violent if the other individual is an absolute female. So what I mean is, nothing is exceptional. And you should all understand that usually most of the sexual offenses are perpetrated by individuals near and dear. So we have to keep a check, because the girl may not be able to tell you what is happening. So we have to keep a check. She may be too scared to name some intimate people around who are harassing her. You are all aware of various instances which are happening. Secondly, in fact, we should not have any reservation in explaining to the girl about the sexuality right from the childhood. We have to tell, if they are inquisitive, we should encourage them to be inquisitive and clear their doubts scientifically, so that they are armed with knowledge to face any particular situation. Now, as the child is growing, there are certain things which the mothers have to observe. One thing is any sort of handling of the female genitalia by the child or any discharge. Usually there could be some foreign bodies left in the orifices that could lead to discharge. Like we have all seen children putting the slaties into the nose, some beads into the nose or ear. We all know about it. So any cavity available, they try to push the thing inside. But one caution to the parents of a girl child: if the girl child has some foreign body in the genitalia, kindly be alert. Somebody around may not be handling her. So we have to keep that in mind. Then as she's growing, she should not be suddenly struck by puberty. Puberty is a long-term process. It takes some time to develop. But menarche, that is the first menses, is a sudden process. So she has to be explained about the breasts which are developing, about what changes are happening at the genitalia. And also, she should be nicely told to expect the first bleeding, because she should not get scared. And I'm sure nowadays most of the schools and teachers, they provide pads and other things. So around that time, from the time of about 10 years onwards, anytime the girl can attain menarche. So we have to be on the lookout and ensure that she doesn't face embarrassment even if she's in the school. Now we have to tell them about the hygiene also, especially, unfortunately with the women, what happens is, unlike most of the men who can ease themselves anywhere and everywhere, women require a proper toilet to ease themselves. With the result, what I have seen is the girl children are advised not to consume too much water. So with the result, they restrict their water to ensure that they don't go to the toilet frequently. And that is not the answer to the problem, because this leads to frequent urinary tract infections. This also has to be kept in mind. And as I already told you, women need much more extra care when compared to the boys. It doesn't mean that the boys should be neglected. And there are two items which are very important for the women. One is, calcium. What happens is the women sacrifices a lot of her calcium later on during pregnancy. You can imagine the whole bones of the baby, they are chiseled out of the calcium the mother provides. So you can imagine how much calcium she would lose. And also she loses some more calcium during lactation. To ensure that the mother is well equipped, we should always, prevention is the best policy. We should not allow her to develop calcium deficiency. For that, the best thing to be done is, during childhood and adolescence, she should be provided with adequate amount of calcium, so that by the time she gets married and is ready for pregnancies, she has enough calcium to spare for the baby. The other element which is very much required is iron. And of course, iron requirement is much more from the time she starts bleeding, she starts having menses. So we have to keep in mind about the iron requirements also. So these are, and plus we have to give them adequate amount of protein. We have to give them balanced diet. We have to teach them what are the correct nutritional matters. They should not develop any food fats to the extent possible. And they should be allowed to exercise themselves, play games, and we should allow them to have a normal growth. They should not be, and any girl child should not be scared to tell her mother anything. We have to create such an amount of confidence in her, so that even if she is inappropriately touched or somebody tries to take advantage of her age and innocence, she should be able to come back and tell the mother so that the mother can take corrective actions. So this is as far as the routine care of the girl is concerned. In fact, as I told you, the most important concern, health concern for ladies and even children, more so in our country, is anemia, that is less of hemoglobin. Less of hemoglobin can be because of decreased intake of proteins or decreased intake of iron or some worms. Of course, these worms are more common during childhood. So it is always preferable to deworm the children frequently so that they should not lose blood through the worms. And one thing is, again, we should not wait for the symptoms to develop. Now, iron deficiency, sometimes it produces anemia, it can produce heart failure, it can produce a lot of fatigue. And another thing is, iron deficiency can also produce lack of attention. They may not be able to perform well in their school. And so it is always better to get her periodically checked up. By clinical examination itself, we can tell whether the girl is anemic or iron sufficient. So these things we have to take care. And for anemias, certain vitamins are also required, like B12, folic acid, vitamin C, vitamin A, they are all required. So they have to be provided in proper proportions. Then, in addition, some hormones are required for preventing anemia, like thyroxine is required. And so all these things, we should not leave it to ourselves. And whenever there is a doubt, it is always better to consult a doctor. Unfortunately, those of us who consider that we have to preventively maintain our vehicles, when it comes to our own, these positions, live positions, we do not think, unfortunately, that they also require preventive maintenance. They should be periodically checked up by the doctor. And for this, I always recommend school health examinations. Sometimes quite a few things are detected when they are going to the school. The girl or the boy may not be able to see what is written on the, blackboard properly. So they would like to sit only in the front row. So if any such things are there, we have to get, periodically we have to get their eye checkup done. In the same way, if they are short of hearing because of any problem, they feel shy to tell that they are not able to hear. And the teacher may feel that they are arrogant. So these things can be avoided if they undergo a periodical medical examination, like for instance, once in 6 months or once in a year. And actually, this should be organized by the school authorities. Otherwise, as parents, you can always suggest to them. And there are plenty of voluntary agencies whom, if you request as doctors, we can just come and carry out these examinations in the particular schools. Now, the second most important problem, more so in ladies, is a thyroid problem. Thyroid problem may be there right from childhood to the adult age and beyond that also. And definitely thyroid problems are more common in women, both hyperfunctioning or hypofunctioning. Now, this hypofunctioning thyroid, the patient refuses to take treatment because it is detected not because of any symptoms. When we do the hormones involved, that is TSH, T3, T4, if TSH is raised but T3, T4 are normal, that means the thyroid is not functioning properly, and to compensate for its hypofunction, the pituitary is functioning more. So this is almost like hypothyroidism. Now these patients require to be treated, and the girl, if you ask the girl or the individual who is suffering from this type of hypothyroidism, if you ask, you have any problem, are you healthy? She says she's healthy. But you give them 30 days of course of thyroxine. After that you ask, are you healthy? Now she will reply, Acha, is it what is meant by good health? So we should understand that some of the health deficiencies are so covered, they cannot make out unless they have the full quantum of those medicines. Now, calcium is also very important. I already told you what is the importance of calcium. Now, as far as the hormonal imbalance is concerned, some of the girls, very small percentage of girls, they may not develop the breasts, they may not grow tall at the proper age. In that case, we should not leave it and we have to consult the gynecologist or endocrinologist. Because sometimes some of the girls may have very early puberty and very early menarche, which we call as precocious puberty. That is also dangerous, because when once they have precocious puberty, to all onlookers they look very mature, but actually mentally they are not mature. They are only of 7 years or 8 years of age. And another problem is they stand the risk of conceiving, unnecessary conception. So this we have to keep in mind. And another problem you may have to observe is if they don't get a period on time, especially if the breast develop and after the breast development is there, within 1.5 years, the periods do not come. It is always better to consult the gynecologist, because sometimes what happens is they are having a period inside, but that flow is being obstructed by some sort of a septum just at the end of the vagina. So this also you should keep in mind. Whenever you have any problem, please understand your child has a right to be seen by a gynecologist or a general physician, so that she can be attended to at the correct time. We all know is stitch in time always saves 7. Now, another common problem is urinary tract infections. Urinary tract infections are more common in the babies, in the girl babies. It is only for the same reason, because the mothers feel that they cannot go to a toilet as and when they feel like. So they advise them not to take water, especially when they are traveling on bus, when there are no facilities. So with the result, they tend to develop urinary tract infections. Another commonest problem nowadays, which probably the patients are more familiar with than the doctors, that is so-called polycystic ovarian disease. In fact, the understanding about polycystic ovarian disease is not very mature in all the lay personnel. Actually, in polycystic ovarian disease, what exactly is happening is some of the needed hormones are not being produced in proper quantities, and some unnecessary hormones get produced. With the result, the girl tends to have irregular bleeding, and she tends to put on a lot of weight. Even she may show a tendency towards becoming diabetic. She develops male characters, that is, she may develop hair on the upper lip, hair on the beard. So these things have to, when once the hair on the beard is there, the parents feel that a dermatologist has to be consulted. But in these cases, the appropriate consultation should be with the gynecologist or the endocrinologist. And this can be attended to. There is nothing to be worried. It can be managed with proper management of weight, proper diet control, and proper lifestyle changes. So there is nothing to be much worried about that. Then sexual health. This is very important. Very, very important. Our children know at their age much more than what we knew at their age. So kindly understand that they know much more than what you expect them to know. So you have to be very careful about this. We should not try to hide anything from them. When times comes, we have to educate them at an opportune moment about the sex education also. And they can be told in simple language they understand about reproduction. We should not add any taboos to that. And if the girl or boy, they are asking us some doubt, it is always better to reply to them with concern. And a note for the mothers, Nowadays the girls are exposed to a lot of these problems, and after all, any individual will have some sort of a temptation, and the girls are no exception. So with the result, and they always, when they do a wrong thing, they would not tell. When do we tell a lie? When we know that the particular thing is bad, so we try to cover it up. Then only we tell a lie. Same is the case with girl children. So the mother has to pay a little more attention. Should find out who are all her friends, what is all happening, why she is coming late. All these things discreetly you have to find out without letting them know that you are doubting them. So my request is, doubt them, but don't let them know that you doubt them. So that is the best way to monitor your children. Now, for instance, what is the best way to confirm that she is not pregnant, she has not conceived? Monthly periods. Now, let me assure you, some of these children, they are so smart, they may feel to be having periods, but they may not be having periods. So you can imagine to what extent, as a mother, you have to take care. Kindly keep it in mind. I'm not trying to lay aspersions, but we have to face the present world. We should understand what is happening. Now, anemia, I already told you. What are all the symptoms? Fatigue, easy fatigability. Okay. And then the skin is pale. And if you look at the face, you find that there is no charm, there is no grace. Okay. And then they may keep feeling dizzy, and they may have leg pains. They may have, in fact, if the anemia is more severe, they have, breathlessness. And another thing is, whether they are having anemia or if they are having hypothyroidism, one of the things that happens is they tend to lose scalp hair. So if there is a lot of hair fall, please get her seen, get her blood hemoglobin checked up, show her to a doctor. He will decide what all investigations have to be done. So these have to be kept in mind. Now, anemias, what are all the risk factors? Some people have congenital anemia, so that familial anemias. So it would not be a problem because it would be running in families like thalassemia or sickle cell anemia. So that we can make out from the parents' history. And then another thing is dietary habits. Actually, the non-vegetarian diet produces more iron than vegetarian diet. So I am not asking you to convert to non-vegetarians, but those of us who are vegetarians, we have to find solace in certain other sources of iron whenever we are running short of iron, by way of consuming iron tablets or iron capsules. Another thing which produces a lot of anemia is pregnancy. Because in a pregnant mother, she has to supply all the blood needed by the baby through herself. So obviously she requires more elements. So we have to look after during pregnancy. Then any girl who is having heavy menses, she tends to lose a lot of blood. And in the blood, iron is gone. Now let me tell you, menstrual blood loss, it is not abnormal, it is normal. But one thing I would like to remind you, an average woman loses about 40-50 ml of blood every month. Now she is having 12 cycles in a month. That's how much? It is about 12 into 50, 600 ml. Now she has such cycles for 30 years, interrupted by a pregnancy. So that means 30 into 600, it comes to almost 18 liters of blood. Now, can you imagine any other normal physiological thing where an individual loses 18 liters of blood? So this is the importance of menstruation. We have to keep it in mind. And any lady who is becoming very weak after menstruation, take it from me, she's losing a lot of blood. She requires iron supplementation. She requires a gynecological consultation, so that those things could be looked into. So these are all the things how we can prevent anemia and take precautions about it. Now, coming to the hypothyroidism. As I already told you, hypothyroidism, can only be detected with the blood test in some individuals who have no symptoms. Unfortunately, one thing I find is when we advise you take thyroxine, they tend to ask, have I to take lifelong? Then I have to tell them, something is deficient in you. So you have to take all through. Now, why don't you think that you have to eat food lifelong? Morning breakfast, afternoon lunch, night dinner. Why don't we think that? And thyroxine is also like that. So, for heaven's sake, you should not try to avoid an indicated medicine. Don't refer to Google for these things. Consult your doctor. He will give you the correct advice. Okay. So, thyroxine is one thing. And whenever an individual has hypothyroidism, as I told you, firstly, she may not have any symptom. She may be feeling all right. Secondly, she may start gaining weight, or she may have body pains. She may have irregular periods or no periods. She may have, if the thyroid has become large, you can find a swelling in the front of the neck. So, and thyroid also, it is in some patients, it is immunological. So there could be family history, okay, and all these problems can be there. And in hypothyroidism, there are also loss of hair. So all these things we have to keep in mind. And any exposure of the thyroid to radiation, it can make the thyroid hypofunctional. And there are a lot of medicines which can suppress a thyroid gland. So all these things have to be kept in mind. And the only way to detect hypothyroidism is regular health checkup. And whenever any of these symptoms, there is a doubt, we have to get the blood T3, T4, TSH done. And TSH is the most reliable one because some patients try to be extra smart when they are undergoing periodic blood test. What they feel is, okay, they may not be taking thyroxine for long, and only the previous 1 week when they are undergoing check, they may start taking thyroxine. I do not know whom they are trying to cheat. They are cheating themselves. So for those patients, the best way to detect is the thyroxine level will be normal, but the TSH will be still very high. So from that we can make out whether they have taken thyroxine only in the past 5 days or they had been regularly taking. Now calcium deficiency also, all the muscle cramps and weakness, tooth decay, osteoporosis, all these things can develop. And in fact, calcium is a very important element for our body because it conveys it is required for muscle functioning. It is required for brain functioning, nerve functioning. It is also required for coagulation, blood to get coagulated when there is any injury. So calcium is a very, very important part of our life. And if the calcium is less, one tends to go in for osteoporosis. That means the bones get absolutely weak. This is what happens in menopause. So one has to take adequate amounts of calcium. Now, the risks for menopause, as they have already mentioned, calcium. Low calcium intake, vitamin D deficiency can also produce calcium deficiency. Now, most of us are working in a protected environment, closed rooms with AC. So that is the reason why so many of us, whenever we are tested, we test positive for vitamin D deficiency. And another thing is, we also, when we are going, we are very much worried about our facial skin. So we apply so-called, sunscreens. Sunscreens again prevent the absorption of calcium through the skin, vitamin D through the skin. So with the result, we tend to develop low vitamin D. So most of us require vitamin D supplementation. Periodic check for vitamin D is a must. And vitamin D also is responsible for the the proper functioning of the heart. It is a very important vitamin, and we should not neglect it. And whenever required, we have to take medications. And some of the medications can produce calcium deficiency. For instance, whoever is taking calcium and iron, they should not take them together. In that case, what happens? They develop, because calcium and iron, they fight within the intestinal cavity and ensure that none is absorbed. So they may develop the deficiency symptoms. Now, physical activity also. Once we lose physical activity, the calcium disappears actually. So we lose much more calcium if we are most of the time bedridden. This point we have to keep it in mind. So even preventive action has already been mentioned here. Now, what are all the various hormonal imbalance? The woman basically needs two hormones, estrogen and progesterone. Okay, and both are inadequate required amounts during her growth. So they look after, and it is they which ensure that she has regular periods. So if because of like in PCOS, there is a disturbance in the hormones. With the result, they tend to have irregular periods, and sometimes if the ovulation happens, then they may have painful periods. Weight gain will be there. Then they may not have adequate libido. They may have dryness in the vagina, and also they tend to go in for more frequent urinary tract infections. So these are all the things which we have to keep it in mind. And the risk factors are, of course, family history, lifestyle, stress, medications, and early or late puberty. These are all the risk factors. Now, here is the preventive actions which are given. So that is the way we tackle hormonal imbalances. And any other things, you have to consult the doctor concerned. Urinary tract infections, somehow they are very common in the women because of some of the reasons I mentioned. And and especially one precaution for the young girls who are getting married, immediately after sex, one should try to pass urine. So that usually most of the urinary tract infections, what we call as, we call it as honeymoon cystitis. This is because of during sex, whatever organisms are there in the urethra, that is the tube, urinary tube, they get pushed into the bladder and they produce cystitis. So to combat that, immediately after sex, the girl should pass urine so that those organisms are driven out. This is what. And they should take plenty of water, and they should keep evacuating themselves more frequently so that the urinary infections can be prevented. Then, of course, with urinary tract infections, they also can have pelvic pain. Okay, and in fact, urinary tract, for obvious reasons, urinary tract infections, the incidence increases with increased sexual activity, and some of the birth control pills, birth control measures, they can also increase urinary tract infections. And sometimes some women may be having some stones or urinary tract abnormalities. They also tend to have more frequent urinary tract infections and any immune system problems. All these things would lead to urinary tract infections. Best thing is plenty of water. Always one should try to, whenever one is cleaning the perineal area, one should go from the clean area to the less clean area. Like in the case of a woman, girl, from the front to the back, and throw that, whatever you are using, throw it there. Then, in fact, genital hygiene is a must, and the clothing always should be loose fitting and not, cotton clothing are always best. They are more airy, and one has to avoid irritating products like any, these deodorants and other things. They should not be used. Even powders can damage the skin there. So we have to keep it in mind. The best way to maintain the hygiene is keep cleaning with warm or lukewarm or cold water frequently after you pass urine, after using toilet. Now, this PCOS is a very common problem nowadays. In fact, this is nowadays about 20 to 30% of adolescents. They have anybody having irregular periods, or they're gaining weight, or they're having some male symptoms like upper lip hair or beard hair. And we examine them. Not all cases are PCOS. So we examine them, and then we will make out what is the problem with them. It is something which can be treated very easily. I would not go too much into its details now, because it itself is a huge topic. We can, if those of you who are interested, we can organize another talk on this so that we can discuss at threadbare about this PCOS. Now, again, prevention of PCOS is basically maintaining ideal body weight. For that, the girl has to be physically active. In fact, unfortunately, these electronic media, they have ruined us. They not only have ruined youngsters, they have ruined old people like me also. Because, it is almost like this is much more a habitual thing than liquor or smoking or whatever it is. So, the more we stay away from the screen, the more healthy we are going to be. In fact, for all the problems, ultimately they lead to the screen. So this small screen is the most dangerous. Okay, children are getting psychological. Children are suffering from ill health because they're always stuck to the screen. They're not exercising properly. This is a very huge topic. And this is where not only the doctors, as parents, all of us have to do. Not only that, we have to enforce it. And before that, we have to enforce discipline on ourselves. So that is the problem as far as weight gain and other things are concerned. Now, sexual health concerns are, as I told, these painful menses, they may be there. And some people may be having vaginal dryness. Vaginal dryness means most probably the hormones are less. Okay. And then low libido and vaginal infections, urinary incontinence, that is losing urine without their control. And all these things, we can always look into them by properly attending to a clinician. Now, one thing for the youngsters is this HPV vaccine. Cervical cancer has been proven to be due to an infection by a virus known as human papillomavirus. So we have to ensure that we don't suffer from HPV infection. For that, this vaccine has to be given ideally at about 13, 14 years of age. Or even if it is missed, it can be given up to 23, 24 years of age. And this HPV vaccine nowadays, we are considering giving it to the men also. Because some of the men have developed, one of the famous Hollywood actors, he developed oral cancer and it was traced to HPV infection because of inappropriate sexual activities. So these things, again, one has to concentrate on that. Then it is always better to avoid multiple partners, because the more number of the partners, the more are the chances of acquiring infections. And usually it is always better to use a condom to ensure that no infections, no serious infections are transmitted to the lady. Okay, I have finished. I think I have taken a little longer time. And now if you have any questions, it shall be my pleasure to answer.
Folks, you can start putting down your questions on the chat. Meanwhile, we do have a few questions that people want to be, answered anonymously. So I'll start putting down the questions on the chat here. So the first question is there anything I can do to reduce the risk of developing ovarian cancer?
Very nice. Very nice question. I'm glad. Ovarian cancer, the exact cause is not known, but there are some associations which are known. Ovarian cancer is more common in those who are, ovulating regularly. That means uninterrupted ovulation. That means if she doesn't have any pregnancies, she stands more chances of developing ovarian cancer. That is one. Number two, if somehow the ovulation in some infertile patients, they undergo ovulation induction drugs. They take them. And those can produce ovarian cancer. Third thing is, one thing I would tell, use of oral contraceptives, that is the estrogen progesterone pills, it reduces the incidence of ovarian cancer. It reduces the incidence of ovarian cancer. So, girls who are indulging in sex, it is always better they consult a qualified man and use oral contraceptive pills. In fact, if anybody uses continuously for 3 to 5 years oral contraceptive pills, they are unlikely to develop ovarian cancer. Okay, kindly keep it in mind. Now, there are some complications which are with oral contraceptives. Now, don't run to Google and see only the complications with oral contraceptives. Then you can't take any drug. So that's why I tell you, if you go to a doctor, he weighs all pros and cons and suggests you to the drug. But for most of the girls, the best contraception is oral contraceptives, that is estrogen, progesterone, or combined contraceptive pills. They do not only reduce the incidence of ovarian cancer, they reduce the incidence of uterine cancer. They also reduce the incidence of fibroids. They reduce the incidence of endometriosis. So there are so many advantages because of consumption of oral contraceptives. I hope I have answered.
Thank you so much for the information, doctor. So the next question is, what is the most effective method of contraception?
Most effective method of contraception, to be very precise, the first most important thing is a disciplined husband. A disciplined husband, I mean it. Because unfortunately, men know that whatever they may do, they are not going to become pregnant. The woman is going to become pregnant. Understand? So, if the men are really concerned about the lady, and they should be, there is no reason why they should not be concerned. I do not want to have an injection which is not needed because it hurts me. Then, why should a lady undergo a surgery which can be avoided, MTP, because they did not use precautions? That's very bad. So this, even the women has to exercise her authority. The best thing is, it depends on the best concept. It depends on at what is the situation. Newly married girl, the unmarried girl, she wants to have sex. She should not have multiple partners, number one. Number two, condom is the best for her because we do not know whether the other fellow is infected or not. Now, as far as the newly married girls are concerned, they should use oral contraceptives. Why? The condom is very, very manipulative. It is they have to take away their attention from whatever they are doing, and they are worried about the condom only. So, in young married women, oral contraceptives are the best. And when once the first child is born, they want to have 2-3 years gap. For those, if they want to have that gap, and even if they don't want any further children, they should use the intrauterine contraceptive device, that is copper T, or there are so many varieties which have come, progestasat, so many varieties. And unfortunately, our society, we only magnify bad things. We don't magnify good things. These contraceptive devices, these IUCD and the copper T, they have become unpopular because of the propaganda by the people who never used it. Because the people who are really using, they would not climb up the home and tell that we are using copper T, we are absolutely happy. They don't tell that. But I feel there is a need for that. Those of the ladies who are comfortable with copper T, they should tell their colleagues, yes, I'm very comfortable. There is no problem. So For having a gap, copper tea is the best. So that is depending on what is the requirement, we can suggest. So these things you always deserve to take an advice and follow the procedure.
Thank you so much for the response, doctor. There is one more question here. What are the common symptoms of menopause and how can they be managed?
See, the ultimate is when she doesn't have a period for almost 1 year because all the ova got exhausted. Now, in fact, menopause, the symptoms they have, it is not only because of the hormonal imbalances, but also because of the age and their social situation there. You see, any lady enters into menopause at about the age of 50 years. At about 50 years, she already has children, 2-3 children, and she's no more young. She's old. But the husband who is 55 years, 5 years more, he feels that he is young, she is not young. Okay, so she probably feels that she has become less attractive because by the time the libido goes down, their requirements are different. So she develops a sort of a complex. Another thing is, by the time she is at the menopausal level, the children have become independent. They are having their own career. So they take decisions like they were not taking earlier. So she thinks they are not bothered about him. So all these things create a problem there. So that girl, that lady has to be managed holistically. We have to manage the problems also, that physical problems, and we have to also give her a lot of moral strength. Okay, there the doctors can be of great help. Doctors, psychologists, counselors, they can all be good help.
And
So basically what they develop is, they have stopped the period and they may have dryness in the vagina. They may have frequent urinary infections. Okay, they may keep having sweats, suddenly sweating, suddenly feeling cold. So all these things can happen. So they can be eminently tackled. Nothing to be worried. Nothing is insurmountable.
so one more question here. What are the risks associated with sexually transmitted diseases, infections?
Sexually transmitted infections, they are very dangerous. Fortunately, there are so many antibiotics now. So people are taking indiscriminately antibiotics. So not very serious things are seen. Like that syphilis. Syphilis was a scourge 40-50 years back. Even the greatest of the leaders died of syphilis. Chacha Nehru died of syphilis. Okay. And then this Winston Churchill's father, he died of syphilis. So syphilis can produce right from mental, what we call as euphoria. He thinks that he is the king, which is not a fact, to heart problems, aortic dilatation, all these things they can produce. In the same way, other gonorrhea are there. They can produce arthritis and everything. Okay. And you got HIV infection, which is very dangerous. Immune system is completely destroyed. So any sexually transmitted infection can be very serious. It can be from normal ordinary complaint of white discharge to even death. So we have to take all precautions to prevent a sexually transmitted infection. And if by any chance we have any suspicion, don't hide. By hiding, you are not allowing the doctor to treat you, number one. And number two, you are going against the society. You are transmitting it to other ladies or other partners who have so much of confidence in you that they are, they have taken the risk of enjoying it. So one has to be careful.
So one more question here. When should one start getting regular gynecological checkups?
Gynecological checkup, actually, in the childhood also, there are certain things which you may not, as I told you, any white discharge from the vagina or any irregular bleeding in the child before starting a menses, or periodically once in a way, get the girl checked up. Okay. And then after she becomes an adolescent, then once in a way, once in a year, once in 2 years, it is enough. In fact, even mother can see. Mother can open and see whether everything is all right, whether there is anything coming out. All these things she can undertake. But thereafter, the gynecological checkup is when once the individuals indulge in sexual activities, then you have to undergo the pap smear. Pap smear is to ensure that the HPV infection has not progressed beyond just infection. It's going to be cancer. So these, depending on the age, we carry. And whenever there is a suspicion, it is always better to consult. Always better to consult. Whenever the milestones do not appear normal to the mother, she should take the child to the gynecologist.
So the next question is, what are the signs of an abnormal menstrual cycle?
Normal menstrual cycle means, usually anywhere between 25 to 35 days cycle is normal. Bleeding for 2 to 6 days is normal. Anything beyond this recurrently is abnormal. So any sudden cessation of period is abnormal. Any heavy bleeding, continued bleeding is abnormal. And in a reproductive age women, any continued and heavy bleeding, we have to first think of pregnancy. Is it due to pregnancy? So abnormality can be if it's too low, the bleeding is low, there is no bleeding, or there is heavy bleeding, there is more frequent bleeding, continuous bleeding. These are all the abnormal types of bleeding. Any abnormality, it is better to be checked.
So the next question is, how can one manage menstrual cramps and the other associated menstrual symptoms?
You see, these are physiological basically. And these menstrual cramps and the little discomfort in the breast and mood changes, these are all due to particularly the hormones. And especially menstrual cramps, they happen only during ovulation in a lady who is having an ovulatory cycle. First of all, and the only other problem is menstrual cramps also can be because of endometriosis, which is a serious disease. So if menstrual cramps are there in an infertile woman, there is a good news and there is a bad news. Good news is if she is ovulating, she stands better chances of conception. But if it is because of endometriosis, then her chance of conception will be very poor. So these things have to be confirmed by the gynecologist. Now, for the normal cramps, ordinary cramps, usually most of the girls, right from their puberty, they tend to have, in the puberty, immediately after the periods in the puberty, they may not have pain because that time it is not ovulated. Then thereafter ovulation starts, then they tend to have pain. So that pain can be looked after by normal antispasmodic. You've got Meftal Spas, you've got Trenex IMF if the bleeding is more. All these tablets can look after the pain. And any tablets you are taking for pain, they should be taken when the pain starts, not when the pain is at peak, because then the effect will be there. And most of the problem with patients is when once we give an allopathic medicine, the same Ayurvedic fellow gives allopathic, they take. But when we give an allopathic medicine, they have a doubt, like, can I not do it with this? I've got self-control. Self-control cannot do everything. As we have self-control, we know what medicine has to be taken. And that medicine has to be taken. And again, I'm telling you, don't be guided by Google. You read Google, come, ask the doctor why it is so, then we will clarify it. Don't draw conclusions by yourselves. Okay, go by the doctor's advice.
That's all the questions we have. So thank you so much
Thanks a lot.
for a very informative session, Dr. Sharma.